Are people following a carnivore diet telling themselves some myths? I'm Dr. Eric Westman, and welcome to my channel where I review and debunk nutritional misinformation. This is a video, thanks for sending ideas for videos, from Mike the Vegan. I've reviewed some of his videos before, and it's the top 5 carnivore myths debunked. And while Mike has a obvious and explicit vegan agenda, he raises some good points in this video. So stay tuned to the end where I give my final thoughts. I'm hosting a free diabetes lab workshop on April 29. If you have prediabetes or type 2 diabetes, this lab workshop will show you the key lab tests to assess your metabolic health, what you need to look at besides fasting glucose and hemoglobin A1C, what triglycerides are and why they're essential to measure, how a low-carb diet can help to reverse type 2 diabetes. Register now to make sure you don't miss it. I've added the link in the description, or you can go to our website at adaptyourlifeacademy.com.
It's Mike here, and today, the top 5 carnivore myths debunked. These are at least 5 that I hear a lot. If you have different ones, let me know down below. We're talking about things like, does meat contain all the nutrients that you need? Or, is oxalate dumping actually real? And what about the dismissal of the whole vitamin C scurvy concern? We're gonna cover that and a ton more, way too much. But these are myths that lure people into the carnivore diet, and it's part of the whole ethos of the diet, which I think is misinformation. We're gonna look at research that I believe backs that. But again, a lot of the carnivore diet argument is that there isn't science against it. Well, because there is no freaking science on it, essentially. So I'll use the science that I can, but I'll also speak in their language, which is anecdotes, by even looking at a bunch of cases on Reddit. But we do have some case reports as well, which is always good to look at. So let's just get right into it.
Well, this is really a good video. I don't mean to demean it, but I have to give just one anecdote of my own where when I was in training as a doctor, I had a patient who came into the hospital. No one could figure out what was going on. He had really high blood pressure. And actually, he would come in several times to the hospital. This is in a different state many years ago. And so I was one of the chief residents who, these are doctors who stay around to help train the next set of doctors. It's generally a year where you're in charge of the conferences and the education, and you get the difficult cases to come in on. So the whole point here is that an anecdote it can be very distorted, because while I sleuthed out that this person was chewing 4 pouches of tobacco a day. Again, this is in a state where people chew a lot of tobacco. And inside these pouches of tobacco was a component, licorice. Licorice is used in this form of chewing tobacco to sweeten it, and it actually can make you hold on to salt, hold on to sodium. Holding on to sodium in some people, and in this person, created a very high blood pressure. So I went to the literature, like any very well-intended person will, and I found an anecdote, a case study published 20 years before of someone who was admitted to the hospital eating chewing tobacco and had a very high blood pressure and a low potassium. They kind of go hand in hand with the excessive licorice. And so I tracked down the author of that paper. He had, an older doctor, and I tracked him down and I said, I think I found someone who has that same problem going on. Admitted to the hospital, high blood pressure, 4 pouches of chewing tobacco a day, and he swallowed some of it, if not all of it. And I remember, I'll never forget, the doctor said to me, well, looks like you found the second case. Well, wait a minute. I thought I was finding this terrible thing that was going on everywhere, and this older doctor, no one had ever contacted him about a second case of the chewing tobacco causing this problem. And I'm afraid we're going to be in that situation here where you may have a case study, there may never be a second case. You may have 2 case studies or 3 or 4. In my experience, when you start getting 4 or 5 case studies of something, especially if you haven't been able to fix something before or if it's a serious problem, that's when you want to really take notice. And in clinical trials, you may not be able to detect very infrequent occurrences, definitely rare occurrences. Sometimes you totally miss them in FDA-approved clinical trials. So when you take a medicine going through this process, you go out into the tens of thousands, 100,000, a million of people taking the drug, you're going to learn things about it that you didn't know before. And actually, Mike, if you haven't seen the surveys, there have been some surveys of people who describe themselves eating carnivore diets. And it's a start. It's not solid prospective research by any means, but there is some content now being generated and going through peer-reviewed journals to just say, yes, these people are alive, there's no major issue. And here we're going to get into that gray area of, maybe there's something, maybe there's not.
Myth number 1, meat has all the nutrients that you need. Yes, looking to chronometer for that classic 2 pounds of steak a day that a lot of people follow on the carnivore diet. Yeah, the nutrition gaps be gapping. First up, we have vitamin B1, which is low AF. B5 misses it a bit, but for B1 deficiency symptoms, they include irritability, which you will see in the comments, poor memory, literally forgetting to eat plants, it's wild, but weight loss as well, so, there's a win. We have folate, which is abysmally low in terms of intake, and yeah, it is the case that Michaela Peterson, carnivore dieter, appears to have gotten a folate deficiency, as she said on Twitter months back. And looking to Reddit's...
Well, hang on. So Mike took an app called Chronometer, and put in just meat being eaten for the day, I guess, and now looking at the nutritional profile. Well, the nutritional profile, even the RDAs or DRIs, the amount the government says you should have, it's based on expert opinion or how to avoid deficiencies. And oftentimes we really don't know how much something needs to be eaten, so there's a general range to be put in there. And I have to just say that, yeah, a keto or low-carb diet or carnivore diet is way off the range in terms of macronutrient recommendations. These governmental guidelines say you should have 30 to 40% of your diet from carbohydrates. And so, no, these diets don't provide the recommended amount of carbohydrates, but I can tell you, you don't have to have the recommended amount of carbohydrates as the government tells you in these guidelines, and you can be healthy. So the guidelines are wrong in terms of carbohydrate intake. And now, in a textbook called Ketogenic that came out in the end of 2023, the science is solid that you can have a low-carb, high-fat diet when it's properly formulated and be healthy. And not only healthy, you can reverse and have a therapeutic kind of diet, reverse medical conditions. And I have to admit that a low-carb keto diet will cause blood changes that are not, quote, normal, because the normal is defined by those who eat carbohydrates. For example, if you are on a keto diet, you have a positive ketone level in your blood, that is ticked off as abnormal, because people who eat carbohydrates don't have ketones in their blood. So what normal is what's commonly seen, not necessarily what is optimal. And so when Michaela Peterson talked about her folate level being low, I needed more information. Was there really an evidence of a deficiency? Just because a blood level is different than those who are eating carbohydrate doesn't mean that you'll manifest the same nutritional deficiency. So I'm afraid comparing to what is recommended is not really a good argument to not do it, because I've seen the recommendations are not perfect. I mean, it's a good guide, but not perfect.
r/carnivore, we can just see a ton of folate deficiency or low level results for those people that actually bothered checking it. Obviously, you want to have a healthy level of folate. Anyway, onto the vitamins. We have vitamin A, super low, vitamin C, D, E, K. I mean, do I need to go through the whole alphabet at this point? This is ridiculous.
So I'm afraid that's not scientific enough to just compare what is recommended to a metabolism, actually, that's very different. So you don't need to eat those carbohydrates, even though it's recommended. I'm pretty sure the nutritional recommendations and nutritional inputs and requirements will be found to change, but depending on what you eat. You actually need more nutrients the more the food that you eat has no nutrients delivered with them. If you're eating lots of sugar, you're not getting any nutrient with the sugar to metabolize the sugar, for example. So I'm afraid this is a weak argument to me.
And we're going to go really deep into vitamin C and research on that later on. But just looking through r/carnivore for deficiencies was when I saw that I wasn't expecting, and that was vitamin B12. From the comments, it appears that the poster isn't the only one with this issue, and those commenters say just take B12 supplements. Next time people attack vegans for B12, I'm just going to hand them a printed version of that post.
Well, now, hang on. It's widely known that vegan diets have a vulnerability, and that's vitamin B12, because plants don't contain vitamin B12. So you'll see when you do a vegan diet, you want to take a vitamin B12 supplement or have something that has it in it. That carnivore case study, all of these, did you take everything on the internet really at face value? I mean, there's been an explosion of knowledge out there, and sometimes when I've sleuthed out what people have said on the internet, it hasn't become true. Wait, sometimes there are trolls, there are people who think they have different things that are going on, and they post. And so, be careful with the internet information. It's really can be, fear-mongering. You can develop paranoia about diets. That's the kind of orthorexia, where you are so worried about having the perfect diet that it becomes almost like a mental illness. So the anecdotes and blogs, posts, and all this, and everyone's doing the best they can, I suppose. But to cherry pick things out, it takes several things out of context. One is it really real? But then, how do you balance the good and the bad? Do you just ignore the 1,000 comments of how the people got better on a carnivore diet? So with any approach, you're always going to want to balance the risks and the benefits of something. And if you are always being buffeted by that rare random side effect, and it reminds me of someone who came to a meeting and presenter said, well, this food causes inflammation, this food causes inflammation, so I just don't eat. Well, that takes it to the absurd extreme. You have to eat something. So you want to just take a deep breath. I always, watching Mike the vegan, I get wrapped up into his anxiety about things, and which is always interesting. Why does he care that you don't eat meat? Well, it's that vegan agenda. It's not necessarily based on health. For your health, it may be the concerns about the environment or the animals, which are valid, but they may not be a concern to you.
We continue with the minerals with super low calcium, copper, magnesium, and manganese. And one Jasmine Foster did a 100+ reference write-up on just how much one might miss their targets for these nutrients, and it's wild. Like grass-fed or not, you're likely to be about 80% short on your calcium intake.
So again, those are meeting targets, meeting guideline recommendations. I don't really get persuaded by that. Now, some people have said you want to eat nose to tail on a carnivore diet, meaning you eat the internal organs. Historically, the animals and humans would eat the innards of the kill before the muscle itself. Are you distorting the nutritional intake of a historical carnivore by focusing just on the meat? I think that's a reasonable question and a reasonable concern. So, well, then why not have liver or sausages that have the insides of the animals for you to eat, or take a multivitamin, like a lot of the vegans do with vitamin B12. So I don't know. There's also this kind of false comparison that since that is this way, it must be bad, and my ways must be good. I don't get into that. I think there are a lot of healthy ways to eat, and just because you don't fall into the quote making your goal, that's not evidence of a problem.
And then there's things you're getting way too much of, like you're getting too much saturated fat, too much trans fat, and definitely too much cholesterol.
Well, we've differed on that in other videos, that when you're eating a low-carb, high-fat diet, you're burning fat. Actually, the fat that you eat, the fat level in the blood actually goes down the more fat you eat if you're not eating carbohydrates, because you're eating and burning the fat that you eat. So, if he's getting upset about that, well, I know he has got, I'm not upset about that, but some of these other nutrients are, I don't know if they're potentially an issue. I asked Amber O'Hearn, who's an independent scientist who has given talks about carnivore types of diets. I asked her to put together a scholarly article, and she published it in a peer-reviewed journal. And you can get just about all of the nutrition that we think you need, from just eating a carnivore diet. And but again, that would be similar to saying this drug has the theoretical basis of doing all these things. What you want is to test the drug or the diet in a certain number of people, follow them over time. Ideally, if you're comparing risks and benefits, you'll have a comparative group, some kind of controlled trial. But point well taken that the carnivore diet has not been well studied in clinical trials, not like the low-fat, low-fat diets, but low-carb, high-fat diets have also been well studied in clinical trials. But the carnivore diet, which is a kind of subset of a low-carb, high-fat diet, has not really been well studied. But the metabolism is very different, and the nutrient requirement, I think, it will be different, although I don't know for sure.
And then finally, in terms of fat, it is totally devoid of omega-3 fatty acids. Like, look at that. That is ridiculous. And the higher amount in grass-fed is still laughably low. And yeah, people can eat fish for it, but a lot of people are just focusing on ruminant meat on a carnivore diet. All right, now for myth number 3, oxalate dumping is real. / just the whole oxalate theory of disease or just health issues in pretty normal people. It is the case that people with like severe kidney issues are gonna have more oxalate problems. But it's at a point where oxalate dumping has become a catch-all term for any problem that somebody is facing on a carnivore diet. That should probably lead them to quitting, but no, that's just purification. You're just dumping these plant-based toxic oxalates out of your body. Here is a carnivore GP listing the dangers of oxalate dumping.
Nausea, vomiting, diarrhea, rashes, fatigue, weakness, palpitations, joint pains, inflammation, arthritis, autoimmune activation. Any kind of autoimmune system and problem, can seriously flare when you get oxalate dumping.
And carnivores blame it for even more. I mean, everything from autoimmune diseases in general, which is probably the main one that I hear, to autism. Yep, you heard that right. And yeah, it is the case that dietarily, there's a distinction there, dietarily, you are getting them from plants. But as this study found, cooked vegetable consumption was associated with 75% lower odds of rheumatoid arthritis, which is obviously an autoimmune disease. And they're telling you to stop eating that to fight things like arthritis. And instead, advise meat only when studies like this one show meat consumption linked to twice the arthritis risk. And major credit to Dr. Sarah Ballantyne, who has a PhD in medical biophysics, who did a couple videos on oxalates and a more modern one.
Under normal circumstances, the body has mechanisms to maintain oxalate homeostasis, regardless of how much oxalates we ingest.
No, she isn't a vegan, if that helps, and she mentions that your body actually makes a ton of its own oxalates. And I would add that means you can never purify, you can never fully dump those oxalates. And to elaborate on her claims, yes, from this study, 60 to 80% of your blood oxalates are made by yourself endogenously, so you ain't dodging this, G. Unsubscribe. Or please subscribe and help me get to 400K, because I'm like on the brink. Please. On her chart here, she mentions that the amino acid glycine is one of the precursors for endogenously made oxalates. It is the case that vitamin C is also one. I know carnivores are gonna be like, huh, yeah, it's all from the vitamin C. Well, hey, let's look at this. In terms of your carnivore diet, meat...
Well, so the oxalates, or oxalate, I have to agree. I'm not fully in line with a lot of this talk and language until I see more evidence. And it's so his point was right at the beginning was well taken, which is, well, there's no evidence against it, and there's no evidence for it. And so we're in that area. I think of oxalate is an older concept that's being rediscovered, which is interesting. And if anything, it's just not very common, or it's being, what you're hearing here is under circumstances where people eat carbohydrates, you don't see an oxalate problem. But if you are doing a more extreme diet, it's lower carb, it's without any vegetables at all, a carnivore type of diet, it might actually bring out a problem that you won't see in those who eat carbohydrates. And the metabolism is very different if you don't eat carbohydrates. And so it's possible that oxalates are a problem in this context when it's not a problem in other contexts. And again, it's this kind of, well, if it's different, it must be bad. Or if the questioning of this, I think, is good, and I think more information needs to be collected and published, ideally, about this in the context of a carnivore diet, because it may be real and it may not be real, meaning people can think that that's what's going on when it's really not. And I don't mean to demean, I don't mean to, there are times when I think there's something that's the problem, and I know that's it. When you really kind of track back and do a scientific study, you add it back twice or three times, or you try to do some sort of experiment about it. It turns out that that's not really what was going on. Even though that's what we thought was going on.
Appears to be the main source of glycine in a normal diet. So when you're eating 2 pounds of that, you're going to be getting about 16 grams of glycine on your 2-pound meat a day diet, yet just probably in the hundreds of milligrams at best of dietary vitamin C from normal natural sources. So which one is your liver going to make more oxalates out of in this context? Well, to further support this, I wish we had some good human studies, but from this rat study where they fed the mice glycine as well as some collagen proteins that have glycine in them also, they found unexpectedly high amounts of endogenously formed oxalate in their poop, as well as 90% of these rats developing urinary stones in 38 days. And yeah, that is one of the concerns. There's calcium oxalate kidney stones, which are the most common type. But do you escape this, especially with all that glycine coming through? Well, this Redditor said, I got kidney stones a few weeks into a carnivore diet. The top commenter said, that's oxalate dumping for ya. At least another less liked comment admitted to seeing long-term carnivores getting kidney stones. And yes, just to fact check that, from the University of Iowa in my home state here, yes, stone formation can happen in a matter of weeks. And of course, we're talking about a keto diet here generally for people on a carnivore diet, and we see a lot of kidney stones in the literature there. A lot of times those are uric acid stones because the purines in meat form those. And uric acid is also what causes gout, which is another inflammatory joint issue. You get those crystals in there. Here's another Redditor who actually got gout for the first time in his life just 4 weeks into his carnivore diet.
So any diet can cause a kidney stone, right? I mean, kidney stones happen even on a Western diet. I bet kidney stones happen on a vegan diet. We just don't hear about them. The question is, how often do they happen? And is there any difference between different diets, or can you match a specific diet for someone if they have that predilection? So best I can tell, in a controlled trial, Dr. Yancey, a colleague of mine, did a controlled trial of a keto diet, low-carb, high-fat, well-formulated keto diet versus a low-fat diet and orlistat, which is a weight loss drug that blocks the fat absorption. And there was 1 kidney stone in each group in that clinical trial. So it could be the weight loss, it could be in any sort of kind of diet, weight loss diet causing a kidney stone. It could be the particular type of foods that you're eating. It could be the dehydration that sometimes occurs on effective weight loss programs. And we do recommend, if you have a history of kidney stones, that you drink lots of fluids, really regardless of what diet that you are following. So this is, again, is kind of like we don't know the extent of how common these things are, and there's been no comparative study to see if it's more likely than any other sort of way of eating.
Anyway, on to the next myth. Myth number 3. Electrolyte supplements are normal and all of this is natural. There's this whole narrative here that we are apex predators that are designed to be eating all of this meat all of the time. But then I have to ask, do lions need to take all the electrolyte supplements that these carnivores are constantly taking? I don't think so. A large portion of the discussions that I see on these carnivore forums is about electrolytes, how they're probably not taking enough supplements or taking LMNT, which is a certain brand, which I'm pretty sure stands for Lion Man Needs This. But what's up with this? What's the explanation for why these people need to down these electrolytes all the time just to feel normal? And we'll talk about the symptoms, but here is a carnivore life coach, Kate, 500,000 subscribers on YouTube. Here she is.
On any version of a low carbohydrate diet, whether that be a carnivore diet or a keto diet, we need more electrolytes. This is because when insulin levels are low, as they are when you restrict carbohydrates, the kidneys excrete more sodium, and this disrupts other electrolyte levels as well.
Yeah, the body is so clearly designed to be consuming carbs that when you don't, your insulin level goes so low that you need to add random minerals in high amounts just to not feel like you're gonna pass out. Yeah, and of course.
Well, hang on. So bring it into the clinical context. As an internal medicine doctor turned obesity medicine doctor, there are people who have high blood pressure. We call it essential hypertension, essential high blood pressure, meaning we don't know the reason, don't know the cause. And the idea of having extra blood volume causing the high blood pressure is pretty common. At least the method of giving a diuretic pill, hydrochlorothiazide or other diuretic to fix the high blood pressure, is usually the first thing a doctor will reach for. So this takes it out of the healthy person, healthy young vegan that Mike's talking to. But I think that's his audience, is that we have people who have high blood pressure. It's a medical issue that I think is from the carbohydrate in the food, just from what he was saying, that you eat carbohydrate, the insulin goes up, you hold on to the sodium. And so for years and years, decades, people have been taught not to have sodium, not to have salt. In fact, it's been sort of taken out of the foods so that you have to add back sodium or take an electrolyte to kind of get back to what is normal. So anyway, again, it's your perspective, and just because when you're eating normal foods now, the high blood pressure is gone, and you can take electrolyte supplements, or actually I don't really push electrolyte supplements unless someone has declared that they need it, meaning they have muscle cramps or they have difficulty with constipation. Then I ask people to add sodium or magnesium. So it's kind of an interesting way of, I don't know, sort of, hang on.
Yeah, and of course down below she sells some fancy type of salt.
But so the idea that if you follow a diet that you need to add in something like electrolytes, well, just independent of the diet, the argument Mike is making is follow a vegan diet and take these supplements. This is a little bit of a hypocritical stance. Now, I don't recommend taking electrolytes or probiotics, but that's what these people are doing.
But it interestingly doesn't appear that lions need to get sodium from any other source. They're just able to eat meat. Their body is adapted to do that, it might be a little bit of a red flag that these carnivorous animals don't need to be taking large amounts of electrolyte supplements. But yeah, anyway. And to combine things together here, ironically, as this study found, going back to kidney stones, high meat and higher sodium intake both made kidney stone resistance worse. Yeah, so what's happening if you don't get these electrolytes more specifically? Well, one of those things in the short term, at least, is the keto flu, perhaps other issues in the long term, but from LMNT's website, headaches, fatigue, cramps, and other symptoms of keto flu often follow when we don't get enough of these vital minerals, especially sodium, and as a result, people stagger around in a low-energy, cranky fuzz. The truth is, those who eat a ketogenic, paleo, or low-carb diet simply need more sodium than the general population.
Well, so the website of a company selling an electrolyte product amplifies too much, I think, the keto flu. I wish it was called headache and fatigue, and most people don't get it. We call it keto adaptation, meaning you're switching from carb eating and carb burning to not eating carbs and fat burning. We store fat on our bodies so that if you have extra fat on your body, you start burning it. That's why this is known as a weight loss or fat loss kind of diet. But again, the general, quote, general population, carb consumers do hold on to sodium more. In fact, might be getting high blood pressure, so that then they need a diuretic to get the salt and the water out. That's a cycle that may not be necessary. Of course, that's getting into the, from the general population into the clinical setting, but it's so common now that I see people on blood pressure medicines. I often wonder if it's because of the carbohydrate consumption that they get the hypertension.
I actually know somebody who's on a low-carb diet and passed out, so I just had to look it up, and yeah, the forums have quite a few cases of people just sharing their classic keto passing out stories. Yeah, it's just a rite of passage for some people, and yes, we also see passing out on a carnivore diet specifically. That brings us to another sub-myth that all these weird, nasty symptoms are just, they're not that big of a deal. It's totally healthy.
Just last week, I had a subscriber asking me why she was experiencing heart palpitations since switching to carnivore. We realized that her sodium intake was probably lower than it should be. And since making that change, the palpitations have went away.
From a carnivore diet coach, heart palpitations, pounding heart, and flutters are a common side effect of the carnivore diet, but in most cases, it's usually temporary and nothing to worry about. They of course say that it could be from a lack of electrolytes. And from this carnivore.diet article approved by Sean Baker, carnivore extraordinaire, in addition to the keto flu, you could see leg cramps, constipation, bad breath, again, heart palpitations, decreased athletic performance, hair loss, and our next one that we're going to get to, high LDL cholesterol, which they of course believe is just fine.
Well, so getting to those other electrolyte issues, I think it's legitimate to call them out, and some people need electrolyte replacement. But again, put it in the context, if someone has changed their diet and they've reversed a serious medical condition, they've come off 10 different medications, which I've done for people, help them get off 10 medications, it may be worth having a transition to be able to get to reversing all those different things. The dietary change can be quite powerful, and it's often underestimated. We're just not taught from our general living that what you eat really matters. And in that first phase of transition from eating carbs to not eating carbs, the blood volume goes down, I think. I think that the amount of fluid you're taking around in the body goes down. And that's why adding salt as a preemptory sort of thing during that keto adaptation can minimize or even take away your chances of getting those keto flu symptoms. So in my program, I teach people to have 1 or 2 cubes of bouillon a day. That would be the equivalent of 1 or 2 LMNTs. And the mitigating of side effects to get to a potent disease reversing type of diet is something that may be worth it. But they're not as common as it's thought to be. And if you're doing a properly formulated sort of approach, your problems are much less, I believe. Though I've not had a clinical trial where we randomize people to carnivore or to our approach, which is low carb, high fat, where you get some vegetables and leafy greens every day. But again, how do you put this in context of the benefits that you may be getting in terms of the side effects, or I wouldn't call these risks really, but they're just side effects.
And I would add on to this by saying the amount of cases of just diarrhea or constipation, it's just a yo-yo that I see on these forums, is nuts. And they're all like, oh, I've had diarrhea for months, but you know, maybe someday I'll dump enough oxalates to like cure my chronic diseases that you told me I have. The amount of nausea posts I see on forums is actually off the charts. Well, that brings us to myth number 4, which is that high LDL cholesterol, bad cholesterol, is just absolutely fine and healthy. In general, carnivore dieters and experts are either completely dismissing the dangers of LDL or massively downplaying them. I mean, we're talking about people often getting to 200, 300, 400, 500, even 1,000, as we'll discuss in a second, when under 100 is considered conventionally optimal, below 70, even better. And then, of course, having to evolve the argument for this all the time. They have remnant cholesterol as an excuse, which I have a whole video on, and how that is not a valid excuse. I wish I could go into all the detail here again, but it'd be another 10 minutes. And then they also have the lean mass hyperresponder, like presentation pre-study.
So hang on. I've reviewed Mike the Vegan's videos on this before, and we're in what's called a paradigm shift, or you could say that there are more than one ways to skin a cat, so to speak. So the idea of metabolic syndrome, meaning it's the triglyceride and the HDL in the blood you look at, as opposed to the total in LDL, which Mike focuses on. Now, Mike's not a doctor, and he's going to be quoting, and he follows what is, I have to say, a overwhelming number of people and experts who say things like LDL causes heart disease, and LDL is the most important thing, when actually the diabetes side of things, metabolic syndrome, is probably more important. And this comes from observational studies that look at risk, the first event of heart attacks. Dugani et al. Is one looking at the risk for cardiovascular disease. And diabetes, if you have diabetes, you want to fix that for heart risk prevention. And not, the cholesterol is a minor player. If you're smoking and you want to prevent your heart disease risk, you want to fix the smoking. So the interesting thing is I paused the video here on the presentation that we're all really following, and eyes wide open, that here on the left-hand side of the panel, it shows the LDL cholesterol of someone has an LDL cholesterol of almost 600 in this study. And my colleagues in internal medicine would fall off over in their chair if an LDL is over 300. This person has an LDL of almost 600. And the people in this study have self-described eating a keto diet, low in carbohydrates, on average for 4.5 years. And not only is the LDL almost 600 here, if you look down at the bottom, the coronary artery CT scan is 0. So that what's happening in this study, people are getting not just the coronary score, but they're getting CT angiograms, and they're going to be followed for a year to see if with LDLs that are this high, now they're not being treated and they're doing it on their own volition. There's informed consent in this study. It's not unethical to do. And this is a very interesting condition or situation where there are people with super high LDLs eating a keto diet, meaning their metabolism is very different. And the question is whether this high LDL really matters. Now, to Mike, he thinks this is just, baloney, when no, this is the reality is that I think some people can be healthy with high LDLs. Now, this study will prove or assess over 1 year whether that's the case. But I've seen people in my office, in my clinic, I've followed them for years with high LDLs, and they don't get heart disease. Now, it could be that they're at higher risk and we just don't have enough people in the study. But what's happening is there is now sort of a chink in the wall of armor of the LDL story. So wall of armor meaning the fortress and the kind of, but what percolates out is to someone like Mike the vegan who has zeal about LDL and it's the only way, when it's not the only way. But you know, for a lot of people, it can be a great construct, a great way to look at the labs and use medications and all. But it's not the only way. And so I'm a scientist. I'm not a proselytizer. I'm looking at this study with great interest, but we don't know the results yet. So, but if someone comes to me and their doctor's worried about a small LDL change and it's only been going on for 3 months, I'm like, you know, let's sit back and relax about this rather than get worked up about it, because there's still a lot we don't know. And the metabolism on a carnivore diet would mimic the metabolism here of the low carb, the hyper-responder study that's going on. That's why it's included in here, and why the LDL may be an issue in the blood to be worried about or not. I'm not sure we need to worry about it.
Baseline results, everyone's going, we're all immune, we're all lean mass hyper responders. I have a whole video on that. But even the researchers who did that meekly warn that you're probably not a lean mass hyper responder if you think you are. I am of the belief that it might as well be lean mass hyper smoker in defense of smoking because of the way that the research was done. But this is where I want to hit a particular excuse that I haven't addressed yet, and that is the notion that, oh, well, high LDL doesn't matter as long as your inflammation is low. You know, it's like you need a match to actually light the fire. Well, that's bogus.
Well, the inflammation story is actually an old one. That inflammation starting the problem of atherosclerotic plaque has been around a long time, and it was just forgotten. The focus on cholesterol was largely drug driven because there was a drug approved and you could lower it and get some, you know, small effects by using medications. And often I will recommend that people stay on a statin medicine, so don't get me wrong, but it depends on that certain individual. I have to think that the mic is like a minister in a church that is giving the story. And it's almost like a religion, and that's fine, but there are different kinds of religions, and it doesn't make sense to someone who's a Catholic to follow a different kind of Jewish religion. And so, but to make fun of it or to demean it or to call it out as being unhealthy when it's not proven yet, that's not quite right.
First of all, we have children who have familial hypercholesterolemia who obviously don't have high inflammation. They're children, but they have genes that make it so just their LDL goes up and they have, you know, bad atherosclerosis. And then if you put them on LDL lowering medication, you can actually reverse the volume of those plaques. But it's not just my word here. We have multiple highly credentialed experts in this field saying the same thing about inflammation not being required. For example, Nutrition Made Simple interviewed a couple of them, like Professor Kaushik Ray, president of the European Atherosclerosis Society, who's published over 200 studies. Here he is.
So if you have inflammation, you accelerate this process. So it's an accelerant in that case, in that situation. But similarly, that if that wasn't true, so if you didn't have inflammation accelerating that process, you had zero inflammation, you'd still get atherosclerosis. But what would happen is the particles get into the wall and your body produces an inflammatory response.
And we also have a lipidologist out of a Lipoproteins Institute. That's Dr. William Cromwell, again, interviewed by Nutrition Made Simple. Here's what he says.
I am not a person who says that inflammation does not matter at all. I'm a person who says inflammation is not where it starts very frequently. Inflammation is added as the process gathers momentum and plaques become more mature over time. All right, so as a result, people say you have to have inflammation in order for ApoB to cause a plaque. You do not. But once we have a plaque, more ApoB feeds the plaque, it grows. And the more inflammation, the more the plaque not only grows, but becomes unstable and leads you to more event behavior.
Well, that's like asking the Pope if everyone should be Catholic. I mean, so the lipid field, and I have a good friend who helped to create the National Lipid Association here at Duke. They're believers. They're going to believe it, and so, but there may be an alternate explanation or even cause. So it reminds me of teaching people, you know, look, there's some people drive on the left-hand side of the road in this world. We don't in the US, and the rules are different, or the cholesterol hypothesis, and really hasn't been proven. It is a hypothesis still, regardless of what these esteemed experts are saying, that it's like using a flip phone when now we have smartphones. You know, so it's not that a flip phone can't work. It's not that LDL focus can't work. It's just there's a different way of doing it, looking at inflammation, looking at metabolic syndrome, the triglyceride, the HDL in the blood, that is probably even more important. Now, in the defense of the old guard who are in charge, there's no randomized trial that says treating the metabolic syndrome like I'm talking about is superior than using LDL reduction with a medication. That study hasn't been done. But what we see clinically is decades ahead of what the research is. And we can reverse type 2 diabetes, which is the single most cause of atherosclerosis in cardiovascular disease. That's the most important factor. Much more prominent than looking at LDL cholesterol.
So you heard it from him, and then more specifically, it's the case that LDL can enter the arterial wall through transcytosis. That doesn't require like a high level of chronic inflammation or anything like that. And of course, that can build up, and the more LDL you have, the more likely that that's going to happen. He talks about that for a sec.
The primary purpose of LDL particles is to transport cholesterol to the liver. That's its primary purpose. By doing that, we're maintaining the normal physiology. But if it's around for long periods of time and our quantity is high, it will transcytose into areas that are not its principal target.
And there's, of course, the excuses about the large, fluffy LDL, which I've gone into a bunch, and Cromwell covers that really well. You know, he's studying these lipid counts for a living, essentially. And I just have to add that it is the case that large versus small particles are not very different in size from this study, 23.5 versus 27.5 microns on average for large versus small. So it's not like grape versus a basketball. It's like one orange versus a slightly smaller orange. And for the bigger picture, Mendelian randomization, looking at genetic difference, trials with that show that LDL is causal to atherosclerosis.
I know this figure, and it does not prove that LDL is the cause, even though the summary says it. And it only occurred to me because I took the time to write a class on cholesterol. It is available at adaptyourlifeacademy.com. And the class actually goes through what LDL does, and it's just education about it. And despite what they're saying, if you would be able to treat LDL like we have, why haven't we fixed heart disease then? Now, I mean, in the 80s, there was a physician who got up this, you know, we're going to reverse and heart disease will be gone by, you know, the year 2000 because we have these drugs now that address LDL. So that was the enthusiasm, and it hasn't panned out. And the enthusiasm that Mike has is that of a believer, the story that's been told, and it can work. It's not the only way to do things.
That's the best data we have here. And obviously a ton of people have had their anecdotal cases of heart issues or cardiovascular issues on a carnivore diet, which have pretty much all been dismissed. But thankfully, that beauty YouTuber who I did a video on before they had a stroke has now gone to a plant-based diet with the help of Esselstyn, you know, to try and fight it, despite originally convincing herself that it had nothing to do with the carnivore diet. But it is wild to see how the community responds. I mean, here's a guy essentially describing the symptoms of a heart attack. He even took enough electrolytes, and people are like, oh, that's from what you ate before your carnivore diet. And then we also have this person saying, you know, whenever they add fatty meals as they're transitioning to carnivore, they get chest pain. They were recommended ox bile as a solution.
So I know it's confusing. I know people will flit from diet to diet and follow people who are the proselytizers, the gurus, and there are a lot of ways to be healthy. And actually, there are more commonalities between a carnivore diet and a vegan diet than there are differences. And the main commonality is you're not having junk food. I mean, if you're doing it with real foods, like both camps will advise but not everyone follows. So I just don't, I can see why there's this flip-flopping of internet reading this information. It can be very confusing. Again, if you are following something like a carnivore diet and you get a heart attack, the idea that you've had a buildup of atherosclerotic plaque for the 50 years before you went on the carnivore diet is not unreasonable. I've had people who feel so good after following our program that they start exercising more, and they may have had a blockage that didn't cause any problem until they started exercising more. So you can't blame something you haven't been doing very long. Here there was the insinuation that a high-fat meal would cause your heart attack, and I think that's just silly. That's just, no, no, that doesn't prove it.
All right, now we're going to get even more into the nitty-gritty with the last myth that I've left here, and that is myth number 5, that a carnivore diet doesn't give people scurvy, and also that your vitamin C requirement is lower. Carnivores are built differently. Yeah, you saw that vitamin C intake on the Chronometer app. It is the case that there's an abysmally low amount that they don't even count in meat, and that can vary a little bit, but it's still extremely low. So you're going to be really on the low end here, and just right in the beginning I have to say that studies over and over again show that higher levels of vitamin C are associated with lower levels of mortality. So like, you want to be on the higher end.
So among those who eat carbohydrates.
But I've seen many times carnivore doctors just completely denying there's no such thing as scurvy on a carnivore diet. Nobody gets it. I don't think it's super duper common because people are probably like cheating and other things that we're going to talk about here. But you know, James Blunt, the singer, got scurvy on his carnivore diet. I don't know why they never mentioned that. I'm scurvy full. Scurvy full. Yep.
Well, I didn't have time to track down whether that was really a serious issue or not, or just checking a vitamin C level. Of course it's going to be low.
But there are also some other cases in the literature here that I have not mentioned on this channel. So let's look to this case report. We have a young person out of Dubai eating an exclusively meat-based diet. Ironically, not just being anemic, but having straight up scurvy with skeletal issues. And the next one is easily my favorite title of like any study I've read in a long time. It's Scurvy in an Unrepentant Carnivore. It's a 54-year-old Appalachian dude who ate essentially mostly canned beef for his diet. Wasn't looking good for him. He had like a 4x2 centimeter sack of dark bloody fluid drained. He was then given vitamin C pills, but you know, after running out of those and getting other health issues, he sought medical attention and admitted that his diet was still limited to canned beef. They go as far as to say that like a diagnosis of scurvy can be made with not just symptoms, but also a diet that is devoid of fruits and vegetables together.
Well, so I looked up those anecdotes and I read them and reminded of that chewing tobacco anecdote, the case study I wrote up and contacted the person who wrote the other case study decades before, and he told me, well, looks like you've had the second case ever because there'd been no other reports. So if these happen, they're rare. The just eating canned beef was an interesting one where the person was really ill. I mean, had skin bruising and petechiae, or these red bleeding spots on the body. And then despite what the doctors told him, the dermatology clinic fixed it up. He went away and then just went back to eating the beef. And goodness knows whatever else. I mean, that's the other thing that often happens. I'm wondering about that case study in Dubai, where there may be some other factor in the causing malnutrition, that often, even in case studies, someone will say they're doing an Atkins diet or a keto diet, and the doctor doesn't ask what they've been eating. So you don't know what version of it are they doing. Are they doing a well-formulated diet like it's been recommended by a program like ours? Or are they doing their own version? The case study of the person in the mountains going away and coming back was interesting, but it was one case. Where's the second one? Now, the interesting thing here is I think this is a possible area of concern, but it wouldn't dissuade me from following someone, following a diet like this, and looking for this sort of manifestation. Now, you could look for something earlier than severe bruising on the leg like he had, and teeth abnormalities. Gum bleeding is something that is commonly, where you never really bled from the gums before, something thought of because of the platelet issue with scurvy. But the whole idea comes back to me that I was at a meeting in Ottawa some years ago, and the expert in Canada on diet got up and said the Inuit who live in the Arctic area had no scurvy. There was no scurvy among the Inuit. And I still want you to eat 5 to 7 or 7 to 11 servings of fruits and vegetables a day, like the US and the Canadian guideline recommend. So there was this understanding that in certain circumstances, without fruits and vegetables, there was no scurvy. And in a different context, there was when people went on ships. It turns out James Lind, who was the scientist who found that giving citrus would fix scurvy, only had to have 12 people in his study. It was such a profound effect. So you could worry about this and not do a carnivore diet. You could worry about it and draw pot shots at it, gee, look how bad it is. Or you could understand that actually organ meats have lots of vitamin C. That the person who got up at Ottawa said the skin of the meat, skin of the animals has enough vitamin C in it, and so to prevent scurvy. And then she said, of course, I want you to have 7 to 11 fruits and vegetables like the Canadian guideline says you should. So that didn't jive with, in the context of a low-carb, high-fat diet, the amount of vitamin C you need may be different. And that, I think that's a plausible argument that's not been properly handled here. It's a different metabolism. Yes, more science needs to be assembled, and I think that is happening. And a lot of internet information and grassroots change occurs before science is now assembling the information. Just this week, there was a paper that was published on an irritable bowel syndrome, getting better on a low-carb diet more than the low FODMAP, the simple sugar diet, and more than just a drug recommendation. And this is 2024. Our paper was published in 2009 on irritable bowel syndrome. So there's a lot of clinical knowledge about this that's way ahead of randomized trials. And not that saying that absence of data is proof of what's going on, it's just that you can react to the ambiguity in two ways. You can be afraid of it, or you can say, well, I'm taking it step by step and being monitored by someone who understands how to use this kind of approach. So, but as Mike admitted, it might just be very rare. Well, I want to know how rare. I want to know. So I don't really want to recommend anything until we have that kind of knowledge in systematic way collected, so that you don't just focus on the good, or in this case, in this video, you just don't focus on the bad.
And while I am stretching here a little bit, it is the case that there are quite a few scurvy symptoms on these carnivore forums like this one, talking about keratosis pilaris, which is pretty common, but at least somebody recommended vitamin C, which I thought was interesting in the comments. Of course, you can get vitamin C from organ meats, but that's just gonna make you sick in another way because it's disgusting. So what do people...
Oh, hang on. Oh, wait a minute. Are you following diets that just, or foods that just taste great, or are you a culture to not like or want certain foods? I deal with this all the time. So, as a doctor, if there's a food or a drug you need, I'm going to explain to you why you need it. And if eating liver was going to save your life from something, you would learn to eat it, not just be kind of dismissive of that. That was too bad. But not that I eat lots of liver, but there's a product that mixes it up with onions and other, that it's not so hard to consume, even if you didn't grow up with it. Like I didn't grow up with it, but show me some good pate that, and there's liver in there, or in other organ meats, and that can be quite tasty.
So what do people use to dismiss this? Well, a lot of it has to do with claims by Dr. Chafee, for example, this carnivore doctor who is literally afraid of plants. Like, I feel like the landscape section in Walmart, he'll just run the other way. Like, they're trying to kill him, is what I responded to before. And he says this is a transporter competition issue. Here he is.
One of those is vitamin C as well. So when you're eating carbohydrates use a GLUT4 transporter to get into your system, be utilized around your body. Same transporter is used for vitamin C. When you're eating a bunch of carbohydrates, that drowns out the vitamin C, and so you need an overabundance of vitamin C in order to absorb the little that you need, and you really only need a little.
So is this true? Is there some traffic jam that occurs with your GLUT4 transporter with vitamin C here? Well, just even a quick look at the biology here shows that the main form of vitamin C, ascorbic acid, is actually transported using a sodium transporter. It is the oxidized version, dehydroascorbic acid, that uses GLUT4, as you can see from this diagram. So it makes it way less likely that there's some sort of weird traffic jam going on, which was just speculation in the first place. And not to get too in the weeds here, but he does go on and make what I think is a bogus claim that, like, Vikings didn't get scurvy because they were eating so much meat, and meat helps them with vitamin C.
And look at the Vikings and things like that. They sailed all over the world. They sailed to the New World, and they were not bringing a bunch of lemons and limes. They had packed barrels full of salted meat, right? They didn't get scurvy.
But yeah, from this actually published paper, there is an Old Norwegian name for scurvy, skirbjur, which was first used in a Viking saga 1,000 years ago. And that the Old Norse population actually knew about how plants could help with it, such as cabbage, which, many people, historians I've read, say they just put cabbage on the ship too. And yeah, this is showing up on these Reddit forums with one post about their vitamin C deficiency in blood results, despite even eating liver for vitamin C. And the number one comment was that blood tests don't reflect tissue levels.
Blood tests don't reflect tissue levels. It's true. Yeah, so Mike's doing the best he can with the kind of common old paradigm beliefs, and it's going to be interesting to see how time passes and how new information is gleaned, and whether someone can have the idea that there's another way to do things.
And I should add that just in addition to that way lower mortality risk with higher vitamin C, low levels of vitamin C can have other symptoms that are notable, like leading to lower immune function, which we've seen bad results with that with COVID on low carb diets. This can occur after many weeks of deficient intake. But it's funny, this carnivore site was like putting the amount of vitamin C in meat up against the percent that you would need to prevent scurvy. And even though in the beginning of the article they said that you can eat enough to prevent scurvy, they're still landing at like 15 to 25% of what you would need. Like that's the goal that they have. It's like 1/9 as much as you need for your RDA.
So let's put this on the list of studies to be done. If you had a fully funded group that could study anything about carnivore diets, but getting back to his dismissive comment, the blood level is not always indicative of what's going on inside the cells. And the study about scurvy that should be done on a carnivore diet, following people and measuring things, should not just focus on vitamin C levels. It should focus on the effect of the vitamin C. How well are you making collagen? How well are you clotting? So focusing on a level of something, it can be a mistake, actually, just a mistake. You can be worried about something needlessly and put that on the carnivore study that needs to be done. Or why not ask the people who self-describe following a carnivore diet, bring them in and test those things that would be relevant to scurvy, not the blood level, but the collagen, the bleeding, the platelet function, all that, the outcomes that scurvy creates. We're seeing this play out in some other blood tests too that are different on people following a carnivore diet, and the idea that you're outside that normal range. Summing up this video, if you're outside the normal range of what you're supposed to be eating, that might be fine, because it's expert opinion on these vitamins and minerals. If you're outside the normal range of what's in the blood, it might be fine, because there's a different metabolism going on, and measuring the cells, the whole human body functioning is really important. And then finally, just focusing on just the random risks. We don't really know how frequently they are, and kind of ignoring all of the positive benefits that are being reported on low carb, high fat, or even carnivore diets is a mistake. You want to also have a reasonable, at least, balance of looking at the positive things that have happened, so you can balance any sort of risk. I hope that's helpful. If you like, please like and subscribe and ring the notification bell. I'm dropping new videos on Wednesdays and Fridays. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell, and check out adaptyourlifeacademy.com.